Good morning, everybody, and welcome this morning. This webinar is brought to you by Strategies 2.0, a statewide collaborative that's funded by the Office of Child Abuse Prevention. Today's webinar is Social Determinants of Health, Impact on Families and Community. We have two wonderful presenters today, and I will introduce them in just a moment. But first of all, I want to go over a little bit of business of the webinar. My name is Carrie Collins, and I am a trainer and consultant with Strategies 2.0. My job today is to introduce the presenters to you and the topic, to make sure that we stay on time, and to help all of you participants in any way possible. Helping me today is my colleague, Alma Tovar. She is in the background. If you are having any difficulties at all with GoTo training, please feel free to message Alma and she will help you from the back room. Let me tell you a little bit about GoTo training. So you all have a little kind of reddish orange arrow that controls your control panel. So you can open and hide your control panel as you desire. You've joined us today either by telephone or by your computer microphone and speakers. If you join us by telephone, then you've clicked on that little round thing that says telephone. And when you do that, you will get the number to call. You will get an access code and a PIN number. So make sure you enter that access code and PIN number, or if we wanted to unmute you, we would not be able to. We've already been using the chat box this morning. Thanks to all of you who have been participating with us this morning, telling us where you're calling from, your favorite summer fruit. Throughout the presentation today, if you have any questions or comments, please feel free to put them into the chat box. Erin and Salita will be managing your questions and comments. And I know that they will be asking you to enter some different questions or comments that you might have into the chat box during their presentation. If you wanted to be unmuted, you could raise your hand and I can unmute you and you could ask your question to them in person if you prefer to do that. So just so that you know, I do have you all muted, so you do not need to worry about any background noise that you may have going on right now. I know that most of us are working from home, and you could have small children. In my case, I have big children that still live with me, or animals, or your yard people, but I don't want you to be concerned about any of that background noise because I have you muted. This webinar is being recorded this morning, and in a couple of days, you will be able to find it on the Strategies 2.0 YouTube channel. That is not going away starting July 1 under the new Strategies TA grant. All of these webinars will still be available to the public, as well as recordings from learning communities, and there is a 4-part series on vehicles for change. So within a couple of days of this presentation today, you will receive a follow-up email from Alma that will have the link to the webinar recording, as well as the handouts that are in your materials section of today's presentation. If you wanted to get into that and download it, you will receive a copy of this PowerPoint following the presentation. An evaluation will be sent to you automatically following this webinar. So we really encourage you to complete that. We take our evaluations very seriously. We look at them. It really helps guide us in the future. You can follow us on Twitter. You can follow us on Facebook. You can go into our website, strategiesca.org. So at this time, I would like to introduce our presenters to you. Salita Dabrowski graduated with her Bachelor's of Science in Nursing and Master's in Nursing Administration from the University of Phoenix. She's been working in public health since 2004, which includes 4 years as a home visitor with high-risk families, a public health nursing supervisor for 9 years, and more recently, administrator for Children's Medical Services. She also serves as the board president for the Partnership for Safe Families and Community, Ventura County's Child Abuse Prevention Council. Erin Slack graduated with her Bachelor of Science in Biology and Masters of Public Health from the Ohio State University. Since 2001, she has been working as the maternal, child, and adolescent health epidemiologist for Ventura County Public Health. Previously, she worked as an epidemiologist at a local public health department in Michigan and for the Ventura County Office of Emergency Services. In her current role, she is responsible for ensuring that the department utilizes data to address the health needs of Ventura County residents across the lifespan. So not only are these two ladies very, very highly qualified to be giving you this presentation today, I am very honored to call Salida also my friend. We have known each other for many, many years through the Partnership for Safe Families. She actually was the wedding photographer, she and her husband at my daughter's wedding, and then found out that Erin and her husband are actually friends of my daughter. So we're all connected one way or the other. So with all of that, it is my honor to turn over presentation mode at this time to Salida, and then she and Erin will take over from this point.
So good morning, everybody. I'm actually going to turn it over to Erin, who's going to kick us off here. All right, can everybody see the PowerPoint?
Perfect, thank you.
This is gonna be strange because the last few months I was just telling Salida when we were talking this morning that I literally have done nothing but coronavirus response since the beginning of March. So this is the first time that I'll be getting back to my maternal and child health roots and talking about social determinants of health, which actually has a huge role in the coronavirus response as well. So I'm glad to be doing something other than that right now. So as Carrie said, if you have questions during the presentation, please do ask them. And I want to make sure that we're all on the same page as we're moving forward. We're going to be talking about the social determinants of health and its impact on families and communities. And these are the learning objectives for this webinar. The first one, how the social determinants of health affect overall community wellness, how to identify geographic areas that may be more vulnerable to child abuse and neglect, your role in identifying how social determinants of health are impacting the families you serve, and then finally, some strategies for supporting communities to address child abuse and neglect. And we're actually going to start off the presentation with just a quick polling question. And I think Carrie's going to have that pop up on the screen for you. Is that correct?
It is correct.
Okay, so we'll give you just a minute or so to look at the polling question. Let's see, can I see the results?
Just in case you can't, the question is, what field do you work in? Are you in healthcare, social work, nonprofit, parent leader, or other? And if it's other, go ahead and put it in the chat box. If you're having a problem getting into the poll, we have found that if you minimize your screen, then you can do it. But don't, just do the best that you can. Over half have voted so far. So let me keep this open for a little bit more. Almost 3/4 of you have voted. Yeah, thank you, Elizabeth. If you can't click on the poll, Elizabeth's in healthcare. Go ahead and put into the chat box what your field is. So I'm going to go ahead and close this up in 5, 4, 3, 2, 1, and share the results. So we have the majority of you are working in nonprofit, 62% in nonprofit, 15% in healthcare or social work, 3% parent leaders, let's hear it for our parent leaders, and 5% other. So we have some home visitors, public health, nonprofit, a few nonprofits, and healthcare written into the box. Let me hide that. Thank you. And it should go right back to your slide. There you go.
Okay, let's make sure. All right, so that sounds like a group of people that we normally work with in public health. One of the things that as an epidemiologist I'm in charge of for our county is we are an accredited health department through the Public Health Accreditation Board. We just actually found out yesterday that we got reaccredited during coronavirus. We actually did our site review in late March, so we were really happy about that. But as part of that accreditation process, we're required to do a community health assessment. And when we first started working on the community health assessment process, we did it in silos. Our public health department did one. Those in the healthcare sector that were from federally qualified healthcare centers did their own health assessment. Those that were nonprofit hospitals that were required to do a health assessment did their own. And then we also had nonprofit partners that were non-governmental organizations that were required to do a health assessment. And so finally last year in 2019, we were able to get all of those community partners together to really do a community health assessment that really spoke to what we do on a daily basis in Ventura County, is really collaborate with all of our community partners. And so we were able to come together, produce one comprehensive community health assessment. That's the first time we've ever done that. In 2016, we had about 6 different health assessments published on the health status of Ventura County population in a 6-month time period. So there was a lot of assessing going on and not necessarily a lot of strategies to develop as a result of those health improvement areas that came out of the assessment. And so now we're really focusing on working together in a more meaningful way when we're assessing the population. So one of the first things that you look at is what are the demographics of your population area. We're obviously from Ventura County, so our population looks a little bit different than other areas in California and also in the United States. In our community, we're about 44.5% Hispanic and 43.2% white non-Hispanic, and followed by Asian Pacific Islander at 7.6%. We're a little bit different than California in that we have a larger Hispanic population and a larger white non-Hispanic population, and California in general has a larger Asian Pacific Islander population. But in Ventura County, our demographics are largely driven by the Hispanic fertility rate. Hispanic Latino women in our community are more likely to have children at a younger age, and they're also more likely to have multiple children. So that's really driving a lot of our population demographic shift. And it's really important as we're designing strategies and interventions in the community that we really look at the community demographics. We survey the community to determine what their priority health issues are. We really engage the community in the health assessment process so that we can design interventions that are most appropriate for that community. So if we look at population projections for race ethnicity, right now we're at 44.5%, but if we fast forward to 2060, about 59% of our population will be Hispanic or Latino in Ventura County. And this is a larger percentage than in California and the United States in terms of population projections. So as our population changes in terms of race ethnic breakdown, so are the needs within our population going to change. And as a health department, we need to continually assess that so we can address those changes in population demographics and needs in our community. And not just from a race ethnicity standpoint, we have a considerably aging population in Ventura County. Our birth rate has gone down significantly. When I first became an epidemiologist in 2011 in Ventura County, we had over 12,000 births in Ventura County. And last year, we had just a bit over 8,700 births in Ventura County. So it's definitely been on the decline. However, our population that's 60 and older has been increasing. If we look at the 0 to 19 population, you'll see right now it's kind of a split between 0 to 19 and 60 and older in terms of females, and then there's quite a few more 0 to 19 males than there are 60 and over. But as we increase our population projections go to 2060, you'll see that we're going to have a huge increase in our 60 and older population. Our actual population in Ventura County is going to decrease by 8.7% over the next 40 years, but the older adult population is going to increase by 30%. And so the needs of our population are really going to be changing. There's going to be less young people to help take care of those older adults. There's also going to be less older adults to help provide childcare and assistance to young families, how the grandparents normally do. So as all of our population demographics shift, we're going to have to find better ways to really address the health needs in our community. And in public health, as well as community health assessment, we also go through strategic planning, and health equity is one of our core values in terms of strategic planning within our department. And health equity, by definition, through the California Health and Safety Code, and I'm sure you've heard a lot about the California Health and Safety Code lately, because we've never really had to enforce some of the information in the Health and Safety Code, and the powers of the health officer have been used quite a bit through the coronavirus epidemic or pandemic. But when we look at health equity, it really means an effort to ensure that all people have full and equal access to opportunities that enable them to lead healthy lives. And I think as we consider the people that you serve in your community and your families, what would really happen if you provided the exact same assistance and intervention to every single family when you went, if you're a home visiting nurse, when you went into the home, if you're a healthcare provider, when they come into your office to provide healthcare, if you're a nonprofit or social services provider. It's not a one size fits all for everyone. And that's why really looking at social determinants of health and the data in the community is so important. And, you know, in our community, we had quite a high rate of teen pregnancy in certain areas, and that's really shifted. Our teen pregnancy rate has gone down considerably since 2009, just like our birth rate. But when we look at that, you know, as public health providers, we see, oh my gosh, there's a high rate of teen pregnancy in these areas, and it's primarily in the Hispanic and Latino population. Over 90% of our births and teen pregnancies are in that population. But when we start to actually, you know, dive into the data and talk to people, a lot of times those teen births are in the 18 to 19-year-olds, not the younger population. And it's not something that's kind of frowned upon. There's a family unit that's there to support that family, that young family bringing up their child. And so just because in public health we see a high rate of, you know, teen pregnancies, for instance, in a community, that doesn't necessarily mean that it's a bad thing for that community and that culture. So it's really looking at the data, but also talking to community members and doing focus groups, doing surveys to determine really what are the priority health issues in the community. Oops. And when we think about what makes a healthy life, we almost always focus on physical health. So we're talking about healthy eating and active living, and that's what a lot of our education has been focused on in public health. But now we're starting to incorporate mental health into that as well. And even the health assessment that we will be doing in the future, we're actually going to be bringing in our behavioral health department into that health assessment process. So it won't be a separate process, and that mental health will be folded into that. But really, social health is such a key as well. And so in this webinar, I'm going to talk about social determinants of health and how they can affect overall health and wellness, because we really want people to live a longer life. We often talk about life expectancy and how long people are living, but we want them to live a longer life that includes adequate physical health, adequate mental health, and adequate social health. And that's where the social determinants of health come in. And a lot of you on the webinar come in to provide positive supports to ensure that people's social health is really improving over time. So when we look at the social determinants of health, we're really defining them as the conditions in which people live, learn, work, and play. And we know that social determinants of health, such as education, housing, poverty, social status, social support networks, your physical environment, they all play a huge role in your overall health and wellness. And really, when we see, even when we're looking at the coronavirus response, we're seeing that communities with lower education levels, substandard housing, multiple families living within a single household, higher rates of poverty are more so affected by coronavirus. In Ventura County, we're seeing a lot of household transmission. So when you have 3 or 4 families living in a single family dwelling unit, you're more likely to have transmission of coronavirus. And even in workplaces that don't follow guidelines, those that are low income earners are more likely to be exposed to that in their workplace. And so when we're looking at the social determinants of health, it affects every aspect of our lives and is more so a determinant of overall health and wellness than even your genetic code. And so in Ventura County Public Health, this has been something that we've been trying to look at and really shift how we're doing our education, our resourcing in the community to really focus on what we can do to play a role in addressing those social determinants of health, rather than focusing on physical aspects of one's health and healthy eating, active living. Because if you don't live in a safe environment that allows you to go to the playground, that allows you to go to the park, if you don't have the means by which to buy those healthy fruits and vegetables, then you won't be able to even listen to our educational messages. So we're really trying to shift that focus to the social determinants of health. So I'm going to go through just a few of the social determinants with data specific to Ventura County, also comparing ourselves to California. But as participants in the webinar, I would love for you to be able to think about in your community, where do you have access to get this type of data to help inform some of the practices that you do within your community? Are you in contact with the epidemiologist at your public health department that could help provide this data to you? Do you have, a regular connection to your public health department in terms of staffing that's working on their community health assessment? Does your county have a website that you can go to? In Ventura County, I'm the administrator for our Health Matters in Ventura County website. We'll have a little screenshot at the end of it, but this allows anyone to go online and look at a lot of this data that I'm providing here. And also, is there a way for you to get involved in your community health assessment project? And Salita will be talking later a little bit about the strategies to help to address the social determinants of health. But this slide here shows the federal poverty status by race, ethnicity in 2018. So Hispanic Latinos in our community are more likely to be living in poverty. This is the same as in California and also the United States, but this is the federal poverty level. And when we look at the federal poverty level, it's the same for all of the contiguous 48 states in the United States. And myself being from Ohio, I know that the cost of living here is much higher than it is in Ohio. When I had to buy a house here in 2010, it took my husband and I like 2 years to even decide to buy a house, because it felt like we were paying so much money for something that we could have gotten for a quarter of the price here. So the cost of living is just much higher here. However, the federal poverty status is the same for California as it is in Ohio. And a lot of our assistance programs are determined by the federal poverty status. And so in California, the United Way has done an assessment based on what they call the real cost measure. And so what are the real costs of actually living in Ventura County? And when we look at that, they estimate that actually 32% of our population is living in poverty versus the 9.6 overall for Ventura County. And this would mean 55% of Hispanic and Latinos in our community are living in poverty versus just the 20% of whites. So, for Hispanic and Latinos, more than about 5% or about 5 times higher. And for whites, it's about four times higher than the federal poverty level. And the real cost measure is really based on household. So it's 2 adults in a household, 1 preschooler, and 1 school-age child. Estimates that is really about $92,000 to live in Ventura County and provide for healthcare, transportation, school, whereas the federal poverty line is $24,000. So we have a huge amount of families in Ventura County living in poverty. And as we know, so much development happens in those first few years of life, and really living in poverty plays a role in child development and just the the environment in which you live. And I know today I was listening to our Board of Supervisor meeting, and our First 5 director, Petra Pulse, was talking about how that, the Stay Well at Home order, we've implemented the Stay Well at Home order and asked everyone to stay safe in their home, but not all children actually have a safe environment in their home. And so even though we've asked everybody to stay home to reduce disease transmission, there are a myriad of other health-related issues that are going to be exacerbated by the Stay Well at Home order, because we know that there's vulnerable populations, and those vulnerable populations are more likely to be living in poverty, less likely to be educated. And so I'm going to talk a little bit about that data here for Ventura County. This slide here shows poverty status by city for total population and children under 18. So with the federal poverty level, you'll see 12.9% of children are living in poverty, but the real cost measure estimates that to actually be about 58% of households with children under 6 are living in poverty. And in our community in Ventura County, there's definitely a disparity in terms of geographic area when it comes to living in poverty. Fillmore, Oxnard, and Santa Paula, you'll see are areas where we have more children living in poverty and more households in general living in poverty in our community. And so those are areas where we need to have more social support systems in place to really wrap around services for those families that have young children that are living in poverty, so that we can increase the number of protective measures that are in place for those areas. If we look at high school graduation, education, which is also an indicator of overall health and wellness, you'll see in Ventura County, 64% of Hispanics versus 96% of white non-Hispanics are graduating from high school. And this is pretty consistent with California and the United States. And this data is from 2018, which is the most recent data point that we have available. Educational attainment is one of those key indicators of the health status of the community. Individuals that don't finish high school, they have less social mobility, less opportunity to significantly increase their income, which is also associated with negative health outcomes. So education, if we can provide anything within a community, education is a huge component of that. And as we know, with the Stay Well at Home order, we've also closed our schools. And so those gaps that we were seeing in educational attainment between those children living in poverty and those higher affluent students, those gaps are being exacerbated by the Stay Well at Home order because of lack of access to internet, lack of access to devices. The schools were doing the best that they could in terms of trying to get up an online learning environment, but not all of our families have what they need to be able to support education in the home for their kids. And so we're probably going to see, further gaps in terms of educational attainment in our community as we continue to transition to an online learning environment. I know we're going to get better at it as time goes on, and we're doing the best that we can right now, but whatever we can do to really increase the amount of in-person learning that can happen, then some of those gaps that we're seeing in educational attainment won't be exacerbated. So this data that you see here is educational attainment for residents 25 years and older. The blue is the high school graduates or higher, and the orange is a bachelor's degree or higher. And what we're seeing here again are areas that have higher poverty rates, like Fillmore, Oxnard, and Santa Paula in Ventura County, are areas where we're seeing lower educational attainment. And those are also areas where we have a lower percentage of people that have a bachelor's degree and also a high school graduation. And if we take that data and we combine it, we see that if we take poverty status by educational attainment, those people with less than a high school education in Ventura County are much more likely to be living in poverty than those with a bachelor's degree or higher. And there's also studies that show that children living in poverty hear an average of 30 million less words from the years of 0 to 3 than their more affluent counterparts. And as you know, that's hearing, reading, talking, singing is so important for child development. And these kids going into school have a deficit in terms of their development, when they're not being read to, they're not being sang to, they're not being spoken to. And it's something that we in public health really try to encourage when we're working with families. Salita will talk about some of the programs that we have to try to address these issues. But even just reading to a child 20 minutes a day will improve their communication significantly and help with educational attainment later in life. We know that, communication at years 2 to 3 is a predictor of reading level at grades 2, 2nd, and 3rd grade. And your reading level in 2nd and 3rd grade is really a predictor of your overall educational attainment later in life. And so we're doing the kids in our community a disservice by really not focusing on improving education, even for the 0 to 3 population before they get into school, because that's such a key, important component to overall health and wellness is one's educational attainment. So I think now we have a quick polling question related to child development before we'll talk about a little bit more about social determinants of health and some analysis from our most recent health assessment. Did we have any questions that came up?
No, we've got some.
Okay, so this question is, what percentage of a child's brain development happens before age 5? 50, 90, or 25%? Once again, if you're having problems getting into the poll, sometimes if you minimize your screen, that helps. Otherwise, please feel free to put your answers in the chat box.
I think so.
And I know that we're, Salita and I are both kind of throwing in some questions into the chat box, hoping that you will respond to them and let us know what's going on in your particular community if you know this. I asked Salita, where could you find this information, and she highly recommended that you form strong partnerships with your own public health department. So we have over 60% have voted so far. I'm going to keep it open for about 10 more seconds. I'm going to close it in 5, 4, 3, 2, and I will share the results. So we have 92% said 90%. 5% of you said 50%, and 3% of you said 25%.
Wow, so everybody already knew the answer. Most people knew the answer, that 90% of a child's brain development happens before the age of 5. So a child's brain actually develops more connections before the age of 5 than they do the rest of their lives. So a lot of that learning is happening in the home environment because they are not necessarily going to school before the age of 5. They may have access to preschool, they may or may not have access to preschool. So we really need to focus on social determinants of health and wrapping around services for the 0 to 5 population, but also supporting young families. And this doesn't even just involve encouraging reading, talking, and singing. It involves social change that allows women and men access to paid paternity and maternity leave to allow them to stay home with their child after the birth of a child, to really focus on that parent-infant bonding and to establish those good relationships and to really be able to support that in all sectors so that there's a disparity in terms of access to paid maternity and paternity leave in terms of low income versus high income earners, and really supporting families in that crucial time of development is what we need to do as a society to really focus on prevention and increase educational attainment in our population. So now I'm going to talk a little bit about Ventura County specific data that was included in the health assessment that came out last year. This shows the leading causes of death in Ventura County in California and then in the United States. In Ventura County, cancer and coronary heart disease were the leading causes of death, followed by Alzheimer's disease. This is the same in California as well in terms of cancer and coronary heart disease. Diseases of the heart is a little bit higher in the United States because they include more ICD-10 codes in their analysis than we do. We always have to do things differently in California. In Ventura County, if we would have included those additional, coronary heart diseases of the heart would have been #1. But what we see in our population is we've had an increase in Alzheimer's disease deaths, and this increase is statistically significantly higher than the rate in California. And so it's something we've been seeing over time and we'll probably continue to see as our population is aging and living longer. We're going to see more of those aging diseases come up in our leading causes of death. Accidents and unintentional injuries are the same as California. Drug-induced deaths are a little bit higher, not statistically significantly higher than California. And then we don't see influenza and pneumonia show up in our top 10 during this time period. In 2019, we actually did have quite a few deaths from influenza. That year, I believe we had 49 deaths from influenza in the flu season that year. And so when we redo this analysis for the next health assessment, we may see that show up in the top 10. But with the leading causes of death, they don't tend to change very much over time. If I put up this slide and put some different years in terms of the dates that are included here, they might not really move all that much over time. So in public health, what we like to look at is years of life lost. And this tends to, the leading causes of death really focus on how the aging population is dying, but years of life lost or premature death lets us look at how young people are dying. And so for the last health assessment, I did an analysis. We had a little over 16,000 deaths in Ventura County from 2015 to 2017. And what I did was I utilized the World Health Organization standard expected years of life lost, and it changes based upon age at death. So if somebody dies within the first year of life, you've potentially lost almost 92 years of life. But if you actually make it to 92, you're pretty healthy, very lucky. So you potentially have lost about 6 years of life. And in Ventura County, during that time period, residents of our county lost 112,045 years of life due to premature death each year from 2015 to 2017. And if we look at the leading cause of premature death, they look different than the leading causes of death. So cancer is still #1. We have about 1/3 of our deaths are due to cancer every year. So it makes sense that they're still #1. And when you look at the premature deaths due to cancer, actually, we have more women dying of lung cancer in our community than we do of breast cancer. And so we're still seeing the effects of all of that smoking that happened, 20, 30 years ago. And as we look at, a lot of young people adopting the use of vaping products, we're concerned that that's going to, continue to rise in our community. But when we look at leading causes of premature death, you'll see accidents is #2. It jumped up to #2 from #5. Drug-induced deaths was #9. It jumped up all the way to #4. Suicide also jumped up. Alzheimer's disease moved down in terms of leading causes of premature death because on average, someone only loses about 8 years of life due to Alzheimer's disease, even though it was our 3rd leading cause of death. Motor vehicle traffic crashes moved up all the way to #10. Now, this could be included in accidents. However, as a group cause of death, it was so much higher than the others, I included it in the top 10. And this is obviously an area of concern because there's things that we can do in terms of prevention. So with leading causes of premature death, we can really focus on what preventative efforts can we put in place to address those drug-induced deaths, to address suicides, motor vehicle traffic crashes, accidents, so that we can really help to reduce those young people dying within our community. So if we take that data for leading causes of premature death and look at average years of life lost per death, we see, for instance, in Ventura County, there were 82 homicides during that time period, and on average, someone lost 57 years of life due to homicide. Firearm-related deaths, 46 years, drug-induced deaths, 45 years, motor vehicle traffic crashes, almost 45 years, suicide, 41 years. So this is basically how our young people are dying in Ventura County, and these are all related to the social determinants of health. So it's not healthy eating, active living that's going to reduce a homicide. It's really looking at the whole built environment and the community and safety, and us working with non-traditional partners to really address the social determinants of health so that we can prevent some of these young people dying within our community. And one place that you can go if you maybe don't have access in your community to an epidemiologist, or your county does not have a Health Matters in Ventura County website like we have, there is the California Healthy Places Index, and this is part of the Public Health Alliance of Southern California, and they take and aggregate 25 social determinants related characteristics of a community, like housing, education, economic, social factors, and they basically create an index based on census tract for your community for those social determinants of health. So this is a wonderful resource for those people that don't have a county that has an epidemiologist that can help with some of this data analysis. I know some of the smaller counties either don't have an epidemiologist at all. I know even we're a larger county, and during the coronavirus, I pretty much haven't been able to support anyone except for do coronavirus response. So we're hiring another epidemiologist, but so there'll be more in certain communities that have higher populations, but this is a great resource. It's free. You can go online and look at your community. You'll see here on the map, those areas that are in dark blue and light blue, those are communities that have less than healthy conditions, and the dark green and the lighter green are more healthier conditions. So if you look for our community, our lowest HPI score, these are from 0 to 100, is in Oxnard, which is a score of 1.4. And then our highest is in Thousand Oaks, which is a score of 97.3. So they have ideal community conditions based on economics, education, transportation. And all of this data is pulled from national data sources like the American Community Survey, the CDC 500 cities data, and it's all aggregated together and available at the census tract level. But really within our community, it's just a 15-minute drive to much healthier conditions. So even though Ventura County in general is higher socioeconomic status, more affluent community, there are pockets all over our county and that have less than healthy conditions, and where we can really focus in terms of our preventative efforts to identify populations that are more vulnerable. These are the same populations that are also more vulnerable to the effects of the coronavirus as well. And so if we look at our Healthy Places Index and all the data that we have for our community, when we look at identification of geographic areas more vulnerable to child abuse, this is the same areas that have less than ideal healthy community conditions have higher rates of child removals. And so Salita is going to talk about our prevention, one of the prevention plan strategies that we have, and it actually targets 3 zip codes in Oxnard where there are higher rates of child removals. And you'll see this map shows here, the lowest Healthy Places Index score of 1.4 is within this area as well. But several areas of Oxnard have less than ideal healthy community conditions, and those are areas where we're seeing, again, higher rates of child removals. So now I'm going to transition over to Salita, and she's going to talk about some of the data that or some of the strategies that we've had that support the data that I've showed you right here. So I don't know. Carrie, is there any questions I need to address before we transition over?
Yeah, I just think it's really interesting, this information that you're presenting, and I hope that participants online are relating this to their own community. I just put in that in my work throughout the state, with prevention councils throughout the state, many of them are focusing on a certain zip code, and I have found that to be very, very interesting. Just like you mentioned in Ventura County, the focus is on a certain zip code in Oxnard. And I think that that's probably true throughout the state and throughout different counties. I would love to hear people in the chat box kind of, comment on, what are they finding in their own counties? Are they finding the same type of trending to be taking place within the counties that they are calling from, that there are certain pockets where they see that there's less resources, less access to resources. So I would love to hear from some of the people, but I think that the information that you're providing is relevant throughout the state.
Thank you so much. I'll turn it over to Salida.
All right. So, Erin provided some really great data, although it's a little disheartening. I'm sitting there listening to it, and I've heard Erin present this data for, a long time, and, just hearing about how dire it can sound in some communities, how our social determinants are really impacting our children and our families. One of the things that I want to really talk about, and as Carrie mentioned, she and I go way back in the child abuse prevention world, and it's been a passion of mine for a very, very, very long time. And I just want to bring up, I'm not sure if any of you have ever heard of the Maasai warriors. They're an African tribe. They were mighty warriors, highly intelligent, very feared in their culture. And they have this traditional greeting. I will not even try to say it in their language, but basically it translates to, "And how are the children?" And this indicated really how valuable children are in this culture and in this particular community. These are the warriors that are asking this question. And if somebody responded to them, "The children are well," it means that peace and safety prevail. And so it's basically a good thing. People were looking at the health and success and state of their community by how well the children were doing. If we could only place that same level of importance on children in our community, how much better off would we be? So in talking about that, I want to look at something that it's a framework. These are activities that strengthen social care integration. This is a framework for how the healthcare system actually can integrate social determinants into their work. We feel that it's relevant in any area, not just healthcare, in looking at what activities are focused on individuals and then activities that are focused on communities. So I really want to talk to you about what you can do, what you can maybe what you're already doing in your community, but how you can kind of approach addressing the social determinants and improving situations for families by looking at activities in these ways. So the first one is there are activities that identify the social risks and assets of defined clients and populations. So Erin talked a little bit about the community health assessment to identify populations that are experiencing health disparities. And so we know in our community where those pockets are, so to speak, of different populations. She mentioned with our young Hispanic teens that are experiencing a higher rate of teen pregnancy. So being able to look at a community health assessment to see what areas are experiencing health disparities, and really adopting a client-centered care model, looking at client needs and values in order to guide your clinical practice. And I know in the nonprofit world, I know that that is really what drives a lot of the work that's done with families. It's very client-centered. And then also screening for social determinants of health in your client population. Adjustment activities, looking at activities that focus on altering care to accommodate identified social barriers. So I think a lot of us now, telehealth has become a new word in our vocabulary. We are all comfortable with it. It's something that we've heard, on multiple occasions. Many of you are probably providing telehealth. This webinar strategies provides webinars all the time. But we miss, at least I miss, in-person trainings, in-person classes, in-person meetings. But now we are looking at providing telehealth, which for some of our families that maybe don't have transportation or they are unable to physically go to an office for an appointment, being able to provide something via telehealth on Zoom or GoToMeeting or any of the other platforms that exist, to be able to offer that to families. And I think that, a blessing in disguise during all of this has been just that. We have all figured out ways to still serve our clients virtually. Also creating a more flexible scheduling system. So as many of you probably know, our clients work or hopefully are working, and maybe they can't meet in the middle of the day, or they can't have a 2 o'clock appointment, and they need more flexible schedules for healthcare appointments, for counseling appointments, for parenting, to be early morning, evening, weekend appointments. And then meet families where they can get to easily. I know oftentimes when I was doing home visits, I know that there's a lot of home visitors in this group today, you know, being able to meet them at a park so that their kids can get out and play, and you know, the parent can meet with you one-on-one, kind of discuss some of the issues, or even meeting them on a lunch break while they're at work, somewhere that's mutually safe for both parties, so that you can still work with them and provide services. We also look at activities that are reducing social risk by linking families with relevant social care resources. In public health, that is something that we do continuously throughout all of our programs, is provide linkage. We want to get families linked up to resources and services, as I'm sure you know a lot of your resources are who we would link up to. So transportation, probably always the #1 thing that we hear from families. They can't get here, they can't get there because they don't have transportation. So looking at vouchers, what are some of the programs out there that can offer a transportation voucher? And also for farmers markets as well. We have a lot of families that screen positive for food insecurity, and aren't able to get healthy fruits and vegetables. They aren't able to have access to fresh food for their family. I know here in Ventura County, we have a very big agricultural community, and you know, our farm workers, we have a large population of farm workers here, and they don't have access to the fruits and vegetables that they pick based on the community that they live in. Their local store might be a 7-Eleven or a convenience store where they have prepackaged junk food, so to speak. So being able to offer to some of these families vouchers so they can get out to the local farmers markets. And then also partnering with CalFresh to provide enrollment services on site 1 day a week. I know here our CalFresh, they are willing, even Medi-Cal, some of our other services that will actually come to an office or a site to be able to provide resources for families to be able to sign up for their programs and services. Alignment activities. So getting, you know, again, Erin mentioned about getting all of our hospitals on the same page for doing community health assessments and improvement plans. So really aligning activities and leveraging the resources that are out there, partnering with non-traditional partners, or even creating a stronger partnership with some of your common partners. So activities that are undertaken by healthcare systems to really understand the existing social care assets in the community, organize them. We want to invest, we want to get them deployed to positively affect health outcomes. So doing that collaborative community health assessment process, implementation strategies, and for us, our future goal is to actually have the Ventura County Community Health Improvement Fund. So really looking at how can we all work together and leverage our strengths, leverage our resources so that we can better serve our families collectively. And then advocacy. Again, looking at specifically at healthcare, but you know, this can be translated across the board, really working to promote policies that change things like transportation. You know, we have bus systems that maybe stop, you know, at 5 p.m. and you have families that are still out getting services and don't have that type of access. So really advocating with your local transportation infrastructure to ensure that they have services and schedules that meet the needs of, you know, many of our working families. Programs like CalAIM, which has been put on hold, that's a state program to increase and improve the access to Medi-Cal resources for people in the state of California. The Caregiver Navigation Project, and then as well, your county's local general plan. So we have our plan that is being worked on for 2040, which seems so far away. And, you know, but we're already starting to think ahead, and what is our general plan going to look like? What are the needs of our community and county moving forward, and how are we going to advocate for those that are experiencing health disparities or social disparities? And I think that with COVID-19, it has greatly changed what our priorities are in our counties, and I would venture a guess that many of you are experiencing the same thing, that our priorities, whether personally or community-wide, have really changed, and we see where the gaps in services are. So to talk first, are there any questions? Maybe we'll start with that.
Okay. There's some real good comments though, Erin. I don't know if maybe you want to read a couple of those comments that people wrote.
Yep, I can pop here. Let's see. So I'm just gonna, to go to Marcella, her comment, our Native American community within the reservation are greatly needing resources in our community. Telehealth is not offered at this point since we're in such a small community. Any specialty care is typically referred out of county, and that's hard for families during the pandemic and for traveling restrictions. Absolutely. You know, we see that as well here in some of our pockets that don't maybe have the same type of access that other communities or families might have. And so being really creative, how do you get services and supports into those communities? Telehealth is not an option for a lot of people. You know, we have families that don't have internet access or their Wi-Fi is kind of spotty. Let's see. So we have, Marcella is an early start resource specialist, but finding resources at this time is now aimed for the entire community rather than just early start, trying to help all the families we can in need. That is excellent. We're happy to hear that, we do have to kind of broaden out how we're providing services during a pandemic. And I'm going to talk a little bit on Thursday at our SoCal Learning Community that Strategies has about how public health is doing the same thing. How are we transitioning to still be able to provide services to families and finding that we're having to do things that are not in our typical role, basically, but ensuring that we can identify those families that are needing services. And I think that during all of this, it's really showed us that while we feel like we're doing a good job serving families, there are so many gaps that are yet to be addressed. So I'm going to talk a little bit about some of our strategies here in Ventura County and how we're working to address social determinants of health, health disparities, health inequities for our kids, especially here in the county, to reduce child abuse and neglect. One of them is we have the Ventura County Essentials for Childhood Prevention Plan, the E4C for short. We actually adopted E4C from the California Department, by CDC. I've got CDC and CDPH in my head, and sometimes they can be interchangeable, even though they're not. But the Essentials for Childhood framework was actually developed by the CDC, and we asked for permission to borrow that as the name of our prevention plan. We were granted permission to do that. So the needs in Ventura County related to the social determinants of health are very complex, and they're not specific to any one system. And so we want to be able to use a cross-system collaboration and an integrated core practice model. In Ventura County, we envision the promotion of health and well-being for all children and families. And so our countywide child abuse prevention plan uses this E4C framework, which is a public health and a collective impact approach to raise awareness and commitment to promote safe, stable, nurturing relationships and environments and prevent child abuse and neglect. That's our big global view in getting this implemented here. We use the data to inform actions that allow us to create the context for healthy children and families through norms, change, programs, and policies. So this is just getting off the ground here, even though it's been a couple years in the making and the development. We're actually starting to get this launched and working in our community. And so here in Ventura County, we focus strongly on convening parent representatives, as well as cross-sector leaders to identify the needs of vulnerable families. And then we're planning to implement a plan to strengthen these families, assuring that all children and their families will have improved access and utilization of supports that promote resiliency and wellness. We recognize that when children and families thrive, child abuse and neglect are prevented. So that's, you know, kind of that big focus is we really are looking at strengthening families. How do we come alongside families and support them? And it's important to have parent voices at the table. I know that there's a couple of parent partners here today, which I'm really happy about. We want to see more parent voice at our different tables. They're the ones that are really speaking to what's going on in the community that we can all learn from. So the Ventura County E4C team knows that when social determinants of health are guided by the needs of families and they're addressed by cross-sector leaders, then we can create a social and physical environment that improves the quality of life, strengthens families, and prevents child abuse and neglect for all of our county residents. So how many of you have heard of ACEs? I hope many of you. So we have the California ACEs Aware Initiative. So hopefully many of you have heard of that, have been participating in it or advocating for it. But this is essentially a way for Medi-Cal providers to receive payment from the Department of Healthcare Services to screen for ACEs. This is a result of an initiative led by Dr. Nadine Burke, who is our California Surgeon General, and the Department of Healthcare Services with the passage of AB 340. The economic toll of the adverse childhood experiences in California is about $112.5 billion. Dr. Burke Harris and other early adopters of ACEs screening are really urging healthcare providers to join this initiative. And so this is something here in Ventura County that we are hard charging after. We want to see this happen here in our county as well. And some of the ways that we're getting this launched here. So for those of you that are from Santa Barbara and San Luis Obispo County, you're partners with Ventura County in the Coastal Tri-Counties Child Abuse Prevention Council. And so that's work that we're looking at being able to do, hopefully moving forward, is creating a structure, creating an environment to provide training for providers on ACEs screening. And then for the Childhood Health and Disability Prevention Program, one of the strategies that we're using in that program, because we work with our local healthcare providers that serve our Medi-Cal population. So CHDP is looking at providing education and technical assistance to support providers to launch this type of screening in their regular pediatric practice. We are going to be providing trauma-informed care training for providers. And then also the state is looking at ACEs screening as one of our performance measures for our local CHDP programs. So we were actually planning on hosting an informational session for providers in April. We provide quarterly noontime in-services. And then, so the plan was to just talk to them about the ACEs screening, what that might look like in their practice, and then survey them for an interest in trauma-informed training so that we would either bring in a speaker for them or provide some type of trauma-informed training for them. Obviously, all of that got put on hold, but not canceled. We definitely plan on offering that to our providers so that we can start encouraging ACEs screening in our community. And I think we have a polling question.
We do have a polling question, which is, does your program screen families for ACEs? So that's either a yes, a no, or planning to begin screening. So we'll just kind of wait. And once again, if you can't get into the poll, please feel free to put your answer in the chat box. We have almost half of you that have voted so far. Leave this open for a little bit longer. The results are interesting. I get to see the results as they come up. So, all right, I'm going to go ahead and close this in 10 seconds. Some of you are putting, Teresa said, no, we do not. I'm going to close this in 5, 4, 3, 2, and 1. And I will share the results. So 29% said yes, 63% no, and 9% planning to begin screening.
All right, so hopefully we can get that 9% up, you know, a lot more, so that you hopefully can encourage your counties to start screening for ACEs and utilizing that information to inform program services that you're offering in the community. So there's going to be a lot of technical support and resources for different programs, organizations, entities, providers to start screening for ACEs. So I encourage you to keep an eye out for that, and hopefully a training will come to your community soon, hopefully. All right, another strategy that we have, how many of you have heard of nurse-family partnership? How many of you have nurse-family partnership in your community? I would think that maybe A handful of you do. So we are excited in Ventura County to finally get this launched. We pride ourselves in this county of always being kind of the first for a lot of things. We like to be on the cutting edge, and we like to be leaders in our state, in the nation. However, Nurse Family Partnership, we've actually been trying to get here for probably a good 10, 11, 12 years maybe. It's a very expensive program. It is an evidence-based community health program. It has over 40 years of evidence showing significant improvements in the health and lives of first-time moms and their children that are living in poverty. So really this is hitting, our social determinants of health, right in one of the key areas of poverty. And the program is designed for low-income first-time moms that are enrolled before week 29 of their pregnancy. And so, like I said, we're in the process of implementing this program here in Ventura County, and we actually just started right before the pandemic hit. That didn't stop us. It slowed us down a little bit, but it has not stopped us from moving forward with it. We've been enrolling moms into the program. So public health nurses provide care, information, and education about pregnancy, early development, and parenting. And the program results in healthier pregnancies. And one of the big key takeaways from this program is it does reduce child abuse and neglect. It improves cognitive and language development. There's fewer childhood injuries and many more cost-saving outcomes to the government and society as a whole. So for California, the data shows that 91% of babies are born at full term instead of being preterm. 95% of mothers initiated breastfeeding. 93% of babies received all of their immunizations by 24 months, and 55% of clients over 18 were employed by 24 months through the program. So really some great data and really great outcomes that have come out of this program that we're excited to see here in Ventura County. All right, so a couple of our other programs, parent leadership programs. Again, as I mentioned, parents are really, really critical to this work and to being able to work and support families. So these are just some of the parent leadership programs that we have here. Through Coastal Tri-Counties Child Abuse Prevention Council, we have parent cafes that focus on the 5 protective factors. They call them cafecitos, which I think is really cute. They're parent-led, and the idea is to introduce the Strengthening Families framework to other parents. Through the Partnership for Safe Families and Communities, our Child Abuse Prevention Council here in Ventura County, of which I've had the honor of being a part of since 2007, and I just have loved seeing all the great work that we're doing in this nonprofit. We offer parent leader training and ongoing support. They're offered twice. The parent leaders are offered time twice a month to debrief and regenerate. And the eventual plan is to harness all of the parent programs throughout the county and have the partnership provide ongoing training and support no matter where they're providing services. We kind of want to be a hub for the parent leaders in our community. We really want to develop a strong cohort of parent leaders available throughout. And the partnership will be hosting the 2021 Parent Leadership Conference here in Ventura County next year. So we're really excited about that. And I know that we're determined to have it in person and hopefully not be a webinar. We are also working on getting parent leaders at any meetings that are focused on children and families in our community, and we're doing that through our Essentials for Childhood Ventura County. And then through Children and Family Services, which is our child welfare department, we have parent leaders that are part of the pre-service training, and they're provided to resource families that are going through certification. So these parent leaders function like a mentor for new resource families or foster families to offer support and guidance through the system. We really want to make sure that we have strong, resilient resource families that are providing services to our youth that are in foster care. And through one of our local nonprofits, Kids and Families Together, we have parent partners and parent leaders that are essential in helping other parents navigate the child welfare system and eventually reunify with their children. So we have parent leaders on all different facets of working with families in the community. And so we want to keep that going. We want to strengthen it and really unify our parent leaders and parent partners here in Ventura County. So for those of you that are
I'm sorry, Salida, I'd be really interested in knowing what other counties, what type of parent leadership programs they have. So if they want to put that in the chat box, that would be fabulous.
Yes, that's exactly what I was going to ask. Is for those of you that are parent partners that are on the webinar today, I would love to know what area you're working in and what are some of the other programs that you are a part of. So yes, we will look for that in the chat box. And I'm going to move on to our next strategy. And I'm just giving you a few examples of things that we're doing here in the county that I feel like could be easily replicated in other counties. So, hopefully something here is resonating with you, and you can kind of take that back and advocate for some of these programs in your community as well. So I feel like these are things that are easily translatable to other areas. So we are proud in Ventura County to now have a family justice center. They just opened up last year. This has also been another thing that's been a long time coming here in Ventura County. And the mission of the Family Justice Center is to support and improve the lives of those that are impacted by family violence and trauma. So the district attorney's office, in order to reduce trauma and improve services, they're committed to this Family Justice Center movement, and they really began to engage the county, the cities, nonprofit agencies in a collaborative approach to serving crime victims in 2015. So this has been, 5 years in the making. The local effort grew to include more than 40 agencies and volunteers working to build the Ventura County Family Justice Center. So we have partners, and this is a physical building located in our community. It is really a one-stop shop for victims of family violence. We kind of wanted people to have one place to go where they could access all of the different support services and resources. So we have partners that are, government agencies like the district attorney's office, law enforcement, local county healthcare agency, including public health. We have a public health nurse that's there. We have our local human services agency, other nonprofits like the Partnership for Safe Families, First Five, the Coalition for Family Harmony, which works with our families that are experiencing domestic violence and sexual assault, City Impact, Forever Found, Interface. We have a whole bunch. There's 35 Ventura County agencies that are part of this Family Justice Center. And they had, even at the beginning, I'm sure it's more, 120 volunteers. So really looking at creating a one-stop shop for families that have experienced violence in their community. So I know that that's kind of a big movement also in different counties to develop these one-stop shops for families so that they don't have to tell their story over and over and over. They can come to one place, tell their story one time, and then have access to all of these different services and resources. We really need to come alongside families, come alongside parents, provide support, provide tangible resources, consistent resources in order for them to rebuild, to nurture their children, to reduce child abuse and neglect, to reduce family violence as a whole. So, let's see. Do we have any? Okay, so we have, okay, so Marcella provides services in Inyo County, Bishop, Lone Pine, Big Pine, Independence. She helps children with delays, intellectual or developmental, ages 0 to 3, offering support groups, parent meetings, resources for other programs in their county. During this time, they've actually provided care packages for 210 families through all branch offices in Kern County, Inyo and Mono County. That is fantastic, and I applaud you because I know that those are a little bit more rural areas. So to be able to get resources together for families is so important. Also collaborating with Kern Regional and First Five. First Five is a great partner. Kids First in Placer County has parents as teachers. We have parents as teachers here as well. The in-home visitation program that works with parents of children up to age 5. So great work, great participation, great partnership. And so it sounds like, other counties have obviously services that are providing support to families, and we want to encourage more of that. We want to encourage you to be creative in who you're working with, how you're working with them, to be able to get support and resources out to families. And oops, I'm going backwards here. So really looking at utilizing those parent partners that are currently in the community as well. So Erin mentioned, kind of where do we go? What do we do? We have Health Matters in VC.org. We encourage you to take a look at our website to see what kind of data we have. Look at maybe some of the similarities, some of the differences between your county and ours. Advocate for a website like this in your county. It's so great. We offer this to our students and to any of our partners to be able to go pull data that will inform their practice. The data helps them to write grants. You know, they can pull some of this data. It's accessible to anybody. We have a lot of contributors to it and a lot of partners in that. And as Erin mentioned, she is the keeper of data in Ventura County, and so she has you know, access to all of that. But this is a way for people to go in and pull what information that they need. So with that, that's just highlights of some of our strategies, some of our work that we're doing here in Ventura County. We would love to open it up for questions for either Erin or myself, if you have any, or any ideas that you want to throw out there.
Started to share my camera again. There's just been some great comments, and this is just such wonderful information. You know, in the last 7.5 years, it's been my honor to travel throughout the county and provide training and consultation to many of the nonprofit groups throughout the county, and to meet many, many of you that are even on this webinar today. And I always just stand in awe of all of the work that's being done throughout the state and the passion that people have to support families and children and to create a better place for them. And you know, I've been able to go to Bishop and Mammoth, and we've been in Kern County and Desto, and so a lot of rural areas as well as our Central Coast counties. And everywhere I go, I hear the same passion, the same work that's being going on as is in Ventura County. The pandemic really kind of threw everybody in a whirlwind. And at the same time, I think it brought out the best in people that we didn't even know existed. I think you mentioned, Salita, that it caused people to have to wear several different hats that weren't normally their role. And that's what I found out. You know, people that were behind the desk are out providing food and clothing and, you know, just basic needs to families. You know, wearing their mask or, you know, whatever they have to do, mask and gloves, and out there providing support. So I think this information you provided was just extraordinary, and I hope that these communities will be able to tap into this information and use it in their own communities. Before we close out, are there any last questions for Erin or Salita? You will get a copy of the PowerPoint that will have, you know, the different websites and things and statistics. So I don't want to close out until everybody's had a chance to ask any questions.
And Erin and I we want to thank all of you that are on here today. You know, this, like Erin said, our whole lives have been COVID-19 for the last few months, and so for her and I to get back to our roots of, you know, social determinants of health and child abuse prevention and supporting families, strengthening families, that, as Carrie knows, has been a passion of mine for a really long time. So it was an honor, even though we had to postpone this a little bit. We're glad we got to be able to present finally, and you know, our contact information is here. We welcome questions, comments, brainstorming at any time. If anybody has questions moving forward, please feel free to reach out to us. Yes, definitely.
Yeah, and I know that Erin commented that there are several counties that are doing that nurse-family partnership. So I think maybe you have some new partners yourself that you could tap into and kind of pick their brains of what they did. Oh, thank you that you love me. I don't know who from Strategies is saying we love you, Carrie, but I love you back. I'm going to go ahead and stop the recording at this point, but I'm not going to end the webinar yet.